Dear Litvinova medical patients, in this video I would like to talk about what measures you can take if you do feel you start coming down with a cold, either a virus or COVID-19. Initial symptoms can be malaise, fatigue, loss of smell, headache, body aches, plus minus fever, nasal congestion, cough, shortness of breath. Sometimes the presenting symptoms can be gastrointestinal, such as abdominal pain, diarrhea, or just loose stool. If that happens, you want to quarantine yourself to minimize or avoid the spread of the infection, and try to rest as much as you can and stay well hydrated. I do recommend avoid icy drinks. It's better to drink either lukewarm or warm water. In my prior video, I recommended 4 special supplements. And when a person is sick, especially with COVID, it increases oxidative stress. And when a person's body is under oxidative stress, requirements of nutrients such as vitamin C, vitamin D increase. Once a person gets sick, it's important to increase vitamin doses just temporarily. Vitamin C, the same 1,000 milligrams, can be taken every 2 or 3 hours, up to 6, 7, or even 8 grams a day. But you only do it for a short period of time, such as 3 or 4 days. A high dose of vitamin C taken at the same time can upset the stomach. But if you take it 1,000 milligrams throughout the day, usually most people tolerate it very well. If you noticed upset stomach, diarrhea, loose stool, then you stop taking vitamin C for that day and you can resume the following day. Vitamin D in the time of a viral infection, including COVID, can also be increased to up to 20 or even 30 IUs a day. Taking throughout the day, you can take your regular dose 5,000, you can triple or quadruple it, or you can take 10,000 2 to 3 times a day. But also you do it for a short period of time, and continue taking probiotics and omegas such as fish oil or flaxseed oil twice a day. The research about COVID-19 has also shown that zinc is beneficial, and zinc is beneficial for immune system and the mucous membrane's integrity. So it's mucous lining makes it more resistant to viral invasion. Many people who develop COVID develop body aches, headache, malaise. It is advisable not to take NSAIDs such as aspirin, ibuprofen, naproxen, Advil, because it can promote a cytokine storm. It's better to take Tylenol or acetaminophen. But I also suggest, if you have more severe symptoms than just mild headache, body aches, or cough, contact me ASAP and we can schedule a Zoom visit or just request a return phone call just to address your symptoms in a more individual approach. In the first stages of COVID-19, for the first 5-6 days, the symptoms are usually mild, and that's a good point to try to balance your immune system. So when the day 6, 7, 8, or 9 comes, the symptoms are usually not very severe, because with COVID-19, it's been shown that those are usually the days when people feel sickest, and after that, many people do start feeling better, although fatigue and headaches, nasal congestion, loss of smell can persist for a longer period of time. Try to take an extra hour or 2 of sleep at night, take a nap during the day. Try to keep a positive attitude, reach out to your friends or family members through Zoom or through phone, because I found that support system is very important to keep a positive attitude, and also for a person to recover better and faster. And eat simple, such as fresh fruits and vegetables, whole grains, and try to avoid doing comfort foods such as sugar, simple carbs, cookies, cakes, because those foods bring inflammation up and weaken the immune system even further. There are a couple of traditional home remedies I would like to recommend. There is no scientific support, scientific studies behind that, but it works and it's very simple and harmless to do. I did recommend it in one of my other videos. Onions have a high level of antiviral, anti-inflammatory substances, vitamins, and you can, before going to bed, you can cut onions in circles and put it in your socks on your soles. During the night, all those bactericidal and virucidal particles will be absorbed and through the lymphatic system, and generally in the morning you feel much better. It's a very safe practice. There is no harm doing it, and I did have a feedback from many of my colleagues and friends, patients who tried that, and it worked very well. The only downside, you may not like the smell. I'm available pretty much during office hours. If you feel you have an emergency, you can reach out to me through my emergency cell phone, but I'm available through to discuss your symptoms by phone, through Zoom, just to give you more specific recommendations. Do stay well and calm. Bye-bye.